name is Lisa Miller. I'm here at Senator Webb's office 2 days before Christmas. Tomorrow morning, the Senate votes on cloture on the health care bill, and then it goes to conference between the House and the Senate, and they decide what parts they mutually like, so that the health care bill will pass. Senator Webb has noted his reservations regarding not only the process of how the health care bill came about, but the quality. He's concerned with the quality of health care and making it more accessible and affordable for Americans. However, when I looked at some of the things that he's offered over the past couple of years, he has expanded entitlement, expanded subsidies to communities such as in Chickateague and the Eastern Shore, Hampton Roads, South Side, Central, and Southwest Virginia. The CHC generates over $22.25 million in outside grants, meaning taxpayers pay for this, and non-patient revenues in these areas contributing to the local economy. I can only submit that the local economy is also taxed for this, and hence it actually makes it less viable for people to hire, and hence make people able to afford their own health care. The problem with any kind of monopoly, and Senator Webb takes great pride in his support of the veterans and how he'd like it to be more flexible for them. So he promoted a reimbursement for long distance travel so that they could get to VA hospitals. I'd submit that's not a good solution for our soldiers. What in fact they should be able to do, if they're suffering from cancer, they shouldn't have to drive 2 or 3 hours to get to a VA facility. Instead, what they should have is fully portable benefits anywhere in the market. And that way they can serve their community by participating right there, paying market costs for their health care that's covered by the government, and the government simply pays their premium, and they decide how and who they want to seek care from. And this serves all of these communities that I just mentioned, especially if we simply, all these poor people who can't get good health care through Medicaid and Medicare, if we simply remove the price fixing, if we stopped cost shifting, then every doctor, every facility would want to take them. We want to give them incentives, obviously, to keep their costs low. So having health savings accounts, which is cash, allows them that flexibility as well as a conscientiousness that this is their money and they should want to make it last as long as possible, as well as, of course, keep themselves healthy. Some of the things that bother me about what Senator Webb has demanded is he likes mandates. He likes to say that health insurance policies must cover X, Y, or Z, whether it's mental health. He's done something on that. He's done something regarding an anti-anemia drug to control the effects of chemotherapy. All of these things should be between the doctor and the patient, as well as the patient or the consumer should decide what should be covered and what should not, to what limit, and whether it be portable or not. So what I'm suggesting to Senator Webb, the best way he could help Americans get affordable and accessible care is to privatize Medicaid, Medicare, and veterans benefits so they're fully portable in the market, and then you either there are several different ways to compel the states to write minimal policies and allow their citizens to buy insurance anywhere in the country. They could simply say, hey, it's illegal for states to say you can only buy our product at our mandated level in our state, and you can't buy it anywhere else. And or there could be a federal regulatory insurance body that allows the privatization of Medicaid, Medicare, and veterans, so insurance companies can come in and service them and compete with those customers, whoever's best at customer service and keeping their costs contained. And it could open up a market for minimal policies that are fully portable anywhere in the United States. The bottom line is the problems that we suffer today are born of monopoly on a federal level, monopoly on a state level, and the states drive to mandate coverage and eliminate choice. What we need, what everyone needs throughout their lifespan, is flexibility and affordability based upon their changing needs. One size fits all doesn't fit all. So I encourage him not to vote for it. I've looked over parts of the bill. The assumptions are, I think, overly optimistic would be a mild term. I think they need to deliberate much longer on this, and I think they need to double check their math. It's greatly concerning that we might end up having, 4 to 5 million unemployed just because of this legislation. They say, oh no, we're going to crank up the taxes, so it's going to be revenue neutral. Well, when you crank up the taxes, that's where the unemployment happens. So you're going to have more expense because you're going to have more people forced onto Medicaid, forced into dropping their own insurance. Hence, you are driving customers into the monopoly as opposed to creating a better system. As it is, it's highly complicated now. The federal government needs to fix the problems they already have and the unsustainable aspects of the current entitlements, not expand them. So, once again, I asked Senator Webb, don't vote for it. Put it off. Allow greater deliberation. Certainly a week is not long enough to consider thoroughly the unintended consequences of a potentially ruinous bill. Thanks, and have a Merry Christmas.